Bismillahirrahmanirrahim. Today's my lecture is about white blood cell, which is also called leukocytes. These cells are colorless, nucleated formed element of blood, which is approximately 1% of total blood volume in healthy adult. The scientific term leukocytes directly reflects its description. It is derived from the Greek word leu, which means white, and cyte, which means cell. These cells are the mobile unit of our body's protective system. The name white blood cell derives from the physical appearance of blood sample after centrifugation. White blood cells are found in buffy coat, which is a thin, typically white layer of nucleated cells between the sedimented red blood cells and blood plasma. The buffy coat may sometimes be green if there are large amount of neutrophils in the sample. It is different from RBC by many aspects. At first, irregular in shape, nucleated, many types, granules are present. In circulation, red blood cell and white blood cell ratio are 500:1, and in bone marrow it is 1:3. Historically, the blood cells are classified into granulocyte and agranulocyte. Granulocyte also classified into neutrophils, eosinophils, and basophils. Agranulocyte in two types, monocyte and lymphocytes. This is the types of WBC. So, these 6 types of normally present blood cells, the first 3 types of cells we called also polymorphonuclear cells. Here, poly means multiple nuclei. The formation of WBC, the granulocyte and monocyte are formed only in the bone marrow. Lymphocytes produced mainly in various lymphogenous tissues, especially lymph gland, spleen, thymus, tonsil, and various pockets of lymphoid tissue elsewhere of the body. The WBC formed in the bone marrow are stored within the marrow until they are needed. Then, when the need arises, various factors causes them to be released. Normally, about 3 times as many as WBC are stored in the marrow. This quantity represents about 6 days supply of these cells. The lymphocytes are mostly stored in various lymphogenous tissue. Leukopoiesis means development and maturation of leukocytes. The blood cells begins their life in bone marrow from a single type of cell called pluripotent hemopoietic stem cells, from which all the cells of the circulating blood are eventually derived. As these cells reproduce, a small portion of them remain exactly like the original pluripotent cell, and it retains in the bone marrow to maintain a supply of these cells, although their number diminished with age. Most of the reproduced cells, however, differentiate to form the other types of cell. The intermediate stage cells are very much like the pluripotent hemopoietic stem cell, even though they have already become committed to a particular line of cells, and which is called committed stem cell. The different committed stem cells, when grown in culture, will produce colonies of specific types of blood cells. Asides from the committed to the RBC, 2 major lineages of WBCs are formed: myelocytic and lymphogenic. A committed stem cell then produces erythrocytes is called colony forming unit of erythrocyte, that means CFUE. Likewise, colony-forming units that form granulocyte and monocytes have their designation CFU, GM, and so forth. This is the figures of leukopoiesis. In individual case, we also call granulopoiesis, which means formation and maturation of granulocyte. In regulation of leukopoiesis, there are some factors. These are hemopoietic growth factor and colony stimulating factor, which influence in differentiation and growth of these cells. In colony-stimulating factors, these are three types: granulocyte CSF, granulocyte monocyte, and granulocyte CSF. These leukocytes break in liver, spleen, lymphatic node. In the properties of WBC, there are margination, diaparesis, amoeboid movement, chemotaxis, and phagocytosis. In margination, which means physiological and transient retention of WBC to vascular wall. Due to margination, about 3/5 of granulocytes and 3/4 of monocytes are sequestered in capillaries, especially pulmonary capillaries. During inflammation, inflammatory product acts on capillary wall, causing extreme amount of margination of both granulocyte and monocyte. In inflamed organ, margination involves a selectin and integrin dependent sequestration of leukocytes in capillary and postcapillary venule. Diaparesis is the process by which leukocytes, mainly neutrophil and monocytes, squeeze through the narrow blood vessel and pore of the blood capillary and leave the circulation. A pore is much smaller than a cell. A small portion of cell slides through the pore at a time. The portion sliding through momentarily constricted to the size of the pore. The amoeboid movement of WBC is the movement of the entire cell in relation to the surrounding, such as movement of WBC through tissues characterized by protrusion of cytoplasm and changes its shape. Typically, amoeboid locomotion begins with the protrusion of a pseudopodium from one end of the cell, and then remainder of the cell pulled through the pseudopodium. This is the amoeboid movement of cell. Here, some cell moves at velocities as great as 40 micrometer per minute, which is a distance as great as their own length in each minute. Chemotaxis is the attraction of WBC towards the injured tissue by chemical substance released at the site of injury. Chemotaxis is effective up to 100 micrometers away from the inflamed tissue because almost no tissue area is more than 50 micrometers away from the capillary. The chemotaxis signal can easily move hordes of WBC from capillaries to the inflamed area. Many different chemical substances in tissue causes both neutrophil and macrophage to move towards the source of chemical. This phenomena is called chemotaxis. Chemotaxis depend on the concentration gradient of this substance. The concentration is greatest near the source. There are at least a dozen of different products which causes chemotaxis. These are some bacterial or viral toxin, regenerative product of inflamed tissue, some reaction product of complement complex, and some reaction product caused by plasma clotting in the inflamed area. Then phagocytosis, which means cellular ingestion of offending agent and use intracellular enzyme to digest them. It is most important functions of neutrophil and macrophage. Phagocytes must have the selectiveness to select the materials, otherwise normal cell or structure of the body might be ingested. The procedures are, at first, most natural structure in the tissues have smooth surface which resist phagocytosis. If the surface is rough, phagocytosis is increased. Secondly, most natural substances of the body have protective protein coat that repel the phagocytes. Conversely, most dead tissue foreign particles have no protective coat, which make them subject to phagocytosis. Thirdly, an immune system of the body develops antibodies against infectious agent, and antibodies then adhere to the bacterial membrane and thereby make the bacteria specially susceptible to phagocytosis. The process by which a pathogen is selected for phagocytosis and destruction is called opsonization. The neutrophil normally constitute about 50 to 70% of total leukocytes, which also known as polymorphs. The granules of the neutrophil take acidic and basic stain. When stained with Leishman stain, granules appear violet in color. The nucleus of neutrophil is multi-lobed. The number of lobes in nucleus depends upon the age of the cell. Its diameter is about 10 to 12 micrometer. It plays an important role in defense mechanism of the body. It is also important in inflammatory response. The eosinophil normally constitute about 1 to 4% of total blood leukocytes. It have coarse granule cytoplasm which stain pink or red with eosin. Its nucleus is bilobed. It has antiparasitic function. It also contains histamines which reduce allergic reaction. It is also responsible for detoxification. The basophil, which constitute about 0 to 1% of total leukocytes. Its nucleus is bilobed, that means S-shaped nucleus. Its granules is coarse granules which contain heparin and histamine. It play an important role in some type of allergic reaction because the type of antibody that causes allergic reaction is immunoglobulin E type. Monocyte, which constitute about 2 to 8% of total WBC. It is the greatest leukocytes. Its nucleus is round, oval, horseshoe shaped, bean shaped or kidney shaped. When the monocytes get into the tissue from blood, it changes its name, which is called macrophage, which activate monocyte macrophage system to release some cytokines. Macrophage can phagocyte up to 100 bacteria. Then lymphocytes, which constitute about 20 to 40% of the total WBC. Its nucleus is oval, bean-shaped or kidney-shaped. Depending upon the size, it is divided into large lymphocytes and small lymphocytes. Depending upon the functions, the lymphocytes is divided into T lymphocytes and B lymphocytes. The immunoresponsive reaction is the functions of the lymphocytes. Generally, WBC play an important role in defense mechanism. These cells protect the body from invading organism or foreign body either by destroying or inactivating them. Total WBC count of our body is 4,000 to 11,000 per cubic millimeter of blood. The differential count of WBC gives the relative percentage of each type of cell that is present in a sample of blood at the time of test. It also helps to reveal abnormal white blood cell populations. This is the percentage of different type of leukocytes. Normally, in adult, neutrophils level is higher than the lymphocytes is also at the birth. But at the 3 to 5 days, the lymphocyte increases and neutrophil decreases, which remains same until the 3 to 5 years. After 3 to 5 years, it's again become normal. This is the physiological variation of WBC. When WBC count is increases, it is called leukocytosis. It has physiological and pathological variation. Leukemia, which is also called blood cancer, here the WBC count is more than 1 lakh per cubic millimeter. All type of leukocytes do not share equally to increase or decrease total leukocytes count. In general, neutrophil or lymphocytes vary in opposite direction. Uncontrolled production of WBC can be caused by cancerous mutation of myelogenous and lymphogenous cells. Metastatic growth of leukemic cells in abnormal areas of body from bone marrow may reproduce so greatly that they invade the surrounding bone, which causes pain and eventually the tendency for bones to fracture easily. Almost all leukemia eventually spread to spleen, lymph node, liver, and other vascular region, regardless of where the origin of leukemia is in bone marrow or lymph nodes. Common effects of leukemia are development of infection, severe anemia, and a bleeding tendency which is caused by thrombocytopenia. An important effect of leukemia on body is excessive use of metabolic substrate by growing cancerous cell. The leukemic tissue reproduces new cells so rapidly that tremendous demands are made on the body reserve for foodstuff, specific amino acids, and vitamins. Consequently, energy of the patient is greatly depleted, and excessive utilization of amino acid by leukemic cell causes especially rapid deterioration of normal protein tissue of the body. So, while leukemia tissue grow, other tissue become deviated. After metabolic starvation has continued long enough, this factor alone is sufficient to cause death. When bone marrow produces very few WBC, this clinical condition is called leukopenia. Normally, the human body lives in symbiosis of many bacteria because all the mucous membrane of body are constantly exposed to the large number of bacteria. That means in mouth almost always contain various types of bacteria, and some bacteria are present to a lesser extent to the entire respiratory tract. In the distal gastrointestinal tract, it is especially loaded with colon bacilli. One can always find bacteria on the surface of eyes, urethra, and vagina. Leukopenia has only pathological condition. These are some conditions where neutrophil count is excessive amount from the normal value. When neutrophil count is decreased, it is called neutropenia. Increased eosinophil count is called eosinophilia. If lymphocyte count is increases, it is called lymphocytosis. Immunity is the capability to resist from pathogens that tend to damage the tissues or organs through biological defense. Here, leukocytes play a major role in providing immunity. When tissue injury occurs, multiple substances are released from injured tissue, causes dramatic secondary change in the surrounding uninjured area. The entire complex of tissue changes is called inflammation. Here, vasodilation occurs, increased permeability of capillary, often clot the fluid in the interstitial space. Fourthly, migration of large number of granulocytes and monocytes to the tissues. Lastly, swelling of the tissue cells. This is the characteristics of the inflammation. Here, the tissue macrophage contribute first line defense, second line defense is neutrophil, and third line defense is second macrophage. In fourth line defense, increased production of granulocyte and monocyte by the bone marrow. Here we see the monocyte macrophage cell or reticuloendothelial system. What is this? This is the total combination of monocyte, mobile macrophage, fixed tissue macrophage, and a few specialized endothelial cells in bone marrow, spleen, lymph node is called reticuloendothelial system. All or almost all these cells originate from monocytic stem cells. Therefore, reticuloendothelial system is almost synonymous with the monocyte macrophage system. Generalized phagocytic system located in all tissues, especially in the tissue areas where the large quantities of particles, toxins, and other unwanted substances must be destroyed. In case of skin and subcutaneous tissue, these cells is called histiocytes. In lymph node, it is called macrophage. In lungs, it is called alveolar macrophage. And in liver sinusoid, it is called Kupffer cell. Spleen and bone marrow called macrophage. The lifespan of WBC is not constant. It depends upon the demand of the body and their functions. The life of the granulocytes after being released from bone marrow is normally 4 to 8 hours and another 4 to 5 days in tissues. In time of serious tissue infections, this total lifespan is often shortened to only a few hours because granulocytes proceed even more rapidly to the infected area and perform their functions, and in the process they themselves destroyed. The monocytes also have a short transient time, that means 10 to 20 hours in blood. But once in tissue, they swell to much large in size to become tissue macrophages, and in this form they can live for months unless destroyed while performing their phagocytic functions. These tissue macrophages are the basis of tissue macrophage system, which provide continued defense against infection. The lymphocytes enter the circulatory system continually along with drainage of lymph from lymph node and other lymphoid tissue. After a few hours, they pass out of blood back into tissue by diaperesis. Then they re-enter the lymph and return to the blood again and again. Thus, there is continuous circulation of lymphocytes through the body. The lymphocytes have lifespan of weeks or months, depending on the body's need for these cells. Thank you for your patience hearing.